Good morning, everybody. Thank you for being here again on a Monday morning. For the record, I'm Dr. Jennifer Vines. I'm the Multnomah County Health Officer. I'm also the lead health officer for the Tri-County region, which includes Clackamas and Washington counties. I wanted to take us through a few items today that I think are of interest. The first, I wanted to just review metrics. Since we last spoke, we've added two new sets of metrics that we're watching, both for school reopening criteria and the so-called watch list. I can share some short-term trends that we're seeing. And then finally, I'll share some regional prevention messages that, again, Washington, Clackamas, and Multnomah are all participating in and want to emphasize. So to start just back with metrics, if everybody remembers the reopening metrics, the idea was originally that we would all stay home, which people did. We flattened the curve really well. So thank you again to all the Oregonians who heeded that call to stay home. And the idea was to get good evidence that the health system was doing well, that contact tracers were set up, and that we were ready for a careful reopening. And so those metrics reflected emergency department visits, hospitalizations, a percent positive test rate that was trending down, the capacity for public health to reach new cases within 24 hours, and for so-called sporadic cases, those without a link to an outbreak, to be under 30%. So if those ring a distant bell, those were the reopening criteria. And of course, Multnomah County remains in phase 1. Last week, we got two new sets of metrics that are slightly different but related. One related to school reopening, which the governor announced in the middle of last week. For that, it's actually a case rate. So for schools to go to full in-person K through 12, we have to be at less than 10 per 100,000 over the prior week. Just for context, Multnomah County right now is at about 80. So we have quite a ways to go. There's a little more room for opening K through 3. That metric is at less than 30 per 100,000. And so for Multnomah County, that would be 244 cases in a week. Right now, again, we're at about, I'm sorry, I think my numbers might be wrong. Maybe Kate, you can check my numbers. I'm not sure I made my notes correctly. So for school reopening, it's essentially number of cases per 100,000. Finally, there's the watch list, which towards the end of last week, Multnomah County joined the watch list of counties. These are counties that the state is looking at closely because of our sporadic cases. So again, these are cases that are not linked to an outbreak, so not explained to a known transmission chain. You end up on the watch list if you're at greater than 50 cases per 100,000 over the prior 14 days. And Multnomah County was at 72 as of last week. So with that comes an offer of state support, a bit more scrutiny, and an understanding that we would not advance to any additional phases for at least the next 3 weeks, which I think no one in Multnomah County expected to advance anyway, given the trends. The context for all this is, of course, a contraction in testing. So we are still seeing less testing available. That is still because of demands on the national supply chain. We're also seeing long turnaround times that we've spoken about before on the orders of several days, which for contact tracing and keeping up with a virus that moves this quickly creates a lot of challenges. The last piece I'll say about metrics is that our time horizon in public health for looking at sort of what's happening and what may have happened is really about 4 weeks. So when people ask us, the week after the July 4th holiday, are we seeing cases from those social gatherings? It's really too soon to say. It really takes at least 3, if not 4 weeks for us to really start to understand what may be influencing virus transmission. And again, the picture is fuzzy because of the relative shortage in testing and the long turnaround times with labs. It creates a delay in our understanding of disease transmission, and it doesn't give us as clear a picture as we might have if we have widespread testing. That said, I can share now some short-term trends. We're asked often about whether protests have been linked to spread of the virus. And we can say pretty confidently, no. They don't seem to be related to spread of the virus. We took a representative sample from our cases that had said yes to having been to a mass gathering last week, and of those, 0 of those mass gatherings turned out to be a protest. So the why is we could speculate on whether it's outdoors, people masking, people staying in their closer social groups as opposed to mixing with strangers. It's hard to say exactly. I will also answer a question that we got if we've had any cases linked to infection related to tear gas. And I did make comments in May about the risk of tear gas, just of irritating eyes, nose, and mouth, people's instinct to, of course, take a mask off, potentially begin to cough, other people to come in close range to try to help that person. There was a lot of concern that tear gas could fuel spread even outdoors, given the way tear gas works. I can say that we have no known cases where someone was infected related to tear gas, but we don't, asking about tear gas exposure is not part of our interviews. Again, having not found people who have attended protests as a mass gathering, this question would not follow and does not currently follow as we interview people with known virus. We continue to see people spreading through social gatherings, camping, travel to Washington and Idaho, small groups gathering for parties, for get-togethers is clearly where we're seeing spread. And as I said last week, it's really among young adults where we're seeing a clear trend. And our partners up in Washington State are really emphasizing that young adults are part of a multi-generational family and community. And so there's real concern about seeing spread from younger to older people, and that may follow. Finally, I'll address the question. I know there's a lot of interest in about how many people are not answering the call from public health. And the way we look at that, and we are going to do a deeper dive on this to better understand it, but what we can say is that we can look up people who have no contacts listed. And that could genuinely be because they've taken precautions and they don't have contacts, or it could be because they declined to talk to public health. So about 15% of Multnomah County's cases have no contacts. So again, at most, it's less than 1 in 5 people with the virus may be unwilling or unable to share their contacts with us. So finally, if you'll bear with me, I want to pivot to some regional messages. So speaking now as the lead health officer for Multnomah, Clackamas, and Washington counties, we are linked and very much working together on a few things. The first is youth outreach, and specifically engaging with youth around a lot of school questions, school worries, messages to youth that if they are going to mix with their friends, that they make sure to avoid the elders in their families and in their communities and anyone else who may be high risk. Washington County is planning social media targeted at young people. So this is really a group of interest right now. We're asking the public, as always, to continue limiting their contacts, to maintain their 6 feet of distance, to absolutely use face coverings, and to keep any social gatherings outside if at all possible. And given the time lag now with test results, we are asking people, if you know that you were in close contact with someone who is now positive, we ask that you go ahead and start your 14-day quarantine, even if you haven't heard from public health yet. Again, it's just the cautious thing to do, and it's the right thing to do from a public health standpoint. That was all I had prepared. I'm happy to do my best to answer your questions, and I'll see if I can get my numbers right with all these metrics.
Thank you so much, Dr. Vines. And yes, you're right. You were right that for the exception for the K through 3rd, it was 30 cases per 100,000 for the preceding 7 days. For 3 weeks, it's a lot of numbers, but you were right. It was like about 240 cases.
Thank you.
So no problem. And Jonathan Bach just had a quick clarification. When you're talking about protests, are you speaking specifically about Multnomah County or the Tri-County area? I believe it was Multnomah.
Yeah, so thank you for that clarification, because I do wear a couple of different hats. So that was for Multnomah County.
Lachey Wesley here with K2 News. I have a couple of questions, specifically about the contact tracers. What are the contact tracers experiencing? Are they running into any issues where people are unwilling to take calls and information from public health. We also heard that there's some issues with misinformation out there.
Yeah, thanks, Lachey. I'm a bit removed from the front lines of this work. I can share a couple of experiences that have filtered to me. Some examples are people who may have unstable housing and may have more people in their apartment than they are supposed to, for example, according to their rental agreement. And so they're not inclined to tell us everyone in the household for fear that they may get in trouble. That's one example. Another is, especially I think for people who turn out to test positive, who have been to a large gathering, they often don't want to, I shouldn't say often, I've heard at least one story of someone who declined to share names and contact information for a bunch of friends and family members, I believe out of concern for privacy, and simply said, I'll let them know. So whether or not they followed through on that, we don't know, but those could be examples where we get fewer contacts maybe than we might like, or have to do some additional coaching and reassuring of people that what they share with us is strictly confidential and would not influence something like their rental agreement or their immigration status or anything like that.
Hi, Doc. Pat Doris here. A couple of questions. With the governor's new metrics for opening schools in person, I think Multnomah County has to get down to 81 cases per week. And right now, we're well above that. Is that possible? And what will it take?
I am an optimist, but Kate can tell me, when was the last time we were that low? I believe it was during the stay-at-home order. A lot would have to happen for us to get that low, but I think I'm increasingly a believer in the science around universal face coverings. I also believe that people want to do the right thing. I think that public health has plans to reach our fastest growing group, which is our 20-year-olds. And so again, it's going to be incredibly difficult to get that low. But I think we have tools that we can implement, and I think we have the public understanding the importance of this.
And
Okay.
Dr. Vines, the last time that we were below 10 per 100,000 was the week of May 17th.
Okay, so yeah, so there you go. That's why we say, we're looking at trends along the order of 4 weeks. So you can imagine it would be several weeks before we could even come close. And you're right, Pat, that's going to be really tough.
Okay, thank you. And then my other question is on the contact tracing. I think last week we were sort of talking about the timelines, and I'm not a math major, but it seems like it could be as long as 20 days from the time person A gets infected until the contact tracers start talking to that person's contacts. And with that sort of a delay, is there any way for it to be effective?
With that kind of delay, again, we miss our big prevention window of identifying contacts early and asking them to stay away from others, also known as quarantine. Thank you for reminding me. This is another story that has filtered up to me as a reason why people may not want to work with public health and give their contacts, is because by the time we get to them, they're better. The test is old news. Maybe they've notified their contacts already. Maybe not, but they're pretty much done. So no question that it really hinders our ability to trace contacts, which is why we're really leaning on people to use face coverings and to take those universal precautions, as opposed to just going about their lives and assuming that public health will get to them in time to tell them about risk of exposure.
And just to follow up on that, is it time to just throw the towel in on contact tracing and just say that it's so widespread now, the virus, that it doesn't matter?
I don't think it's time to throw the towel in. I think contact tracing has a role in control of this disease. So testing and contact tracing both have a role in this disease. Where they're most important is in congregate settings like long-term care facilities, food production sites, places where we can actually find an outbreak and put in prevention measures to stop it. When we do have this level of community-wide transmission, that's when it becomes even more important for the universal precautions approach of using face coverings and really asking people to limit their number of social contacts and to really respect the social distancing and just assume that anyone they come into contact with may have the virus.
Okay, thanks. And just one last question, then I'll yield the floor to my colleagues. But as far as the protest, is it possible that people who were at the protest and are positive just don't want to tell you that because they're worried about tainting sort of the image and concerning the thousands of others who were also there?
It is certainly possible. Again, speaking for Multnomah County, we did a few things. Is we actually outreached to protest organizers to say, hey, we're public health. We don't judge. We directed people to our East County testing site if they had been at a protest and wanted to get tested. So we really tried to convey that working with public health was, was a safe thing to do from the standpoint of participating in the protest, just so we could answer this question that is of interest to the community. So again, having done that, I can't say what people think or exactly what they do, but we did really try to look for an answer to this question, and we can't seem to find the bump.
Okay, thank you very much.
Elon Gluklich here from the Lund Report with a question about pediatric cases. I saw the first report, indicating only one reported case of this, potentially dangerous multi-system inflammatory syndrome. But sort of given some anecdotal reports across the country, there was that camp in Georgia, and just where we are in August and schools. I mean, I'm just wondering kind of what Multnomah County's indication or thoughts are as far as, the rate of spread within, specifically, under 20, 18 to all the way down to kindergarten. I mean, just as September kind of comes around the corner, what is Multnomah County's perception of the risk or rate of spread just within, 18 and under?
18 and under. So we have those numbers. I don't have them off the top of my head. I can share that 18 and under, it's fairly well understood that the virus spreads easily among this group. Mm-hmm. It's generally accepted that children, for the most part, especially young children, don't get severely ill, but you point out the multi-system inflammatory disease, which speaks to kind of the unpredictability of this virus and our inability to predict who may get severely ill. So while it's relatively few children, it's still a concern and not something that we completely understand. I think as we look nationally to other schools that are reopening or to camps that have been open over the summer, I think we see how quickly the virus can spread in a school setting, and in particular, the risk that it presents to teachers and between teachers and other teachers. So as important as it is from a public health standpoint to have kids in school learning, getting meals, getting all the support services that schools offer, so foundational to our community and to our kids' well-being, we don't yet fully understand how to manage this virus in a school setting. So I think with the governor's criteria and with Portland Public Schools and other schools going to distance learning, I think that gives us time to learn from others' experiences, figure out what works and figure out what doesn't work.
Okay, thank you.
Dr. Vines, I have a question kind of related to schools. Some parents are considering learning pods or micro schools for their children this fall. How can parents do this safely?
So we have information through our call center about these types of questions, and it's this notion of creating basically a small stable group, and it's similar to what the official childcare guidance, which is to create small stable groups where kids are watched really closely for illness, and there's not a lot of or any rotating in and out of other children or other adults, and then everyone agrees within that group to take only minimum risk necessary to carry out their essential functions, whatever those are, and everyone in the group kind of has a shared understanding of their risk. So that's basically how you do it, and it's this notion of kind of stabilizing your social context to a fixed group, as opposed to the churn of context that kids might have in a larger school or in a routine school setting. But people with questions can call our call center, and we have fielded some of those asks for advice.
Hi, Dr. Vines. It's Amelia with OPB. What what help has Multnomah County asked the state for?
Yeah, so we, as a unfortunate member of the watch list, the state kindly offers us help and prioritizes specific requests or needs that we may have. Our county chair is still finalizing what those requests are going to look like, and we'll be sharing those with the state this week. And it ranges from some specific asks for supplies to how we handle outbreaks. And so more details will come.
A follow-up question related to the school reopening metric and what you've said about what's driving our cases right now. Is it fair to say that you need teens and 20-year-olds to cover their faces and stay home more to make it possible for younger children and younger siblings to go back to school?
That would be one simplified way of saying where we are right now, given that the 20-somethings are our fastest growing group, and given that the more they socialize, again, our health systems will stay clear, we'll stay able to handle their work. But to the extent that 20-year-olds will continue to drive our case rate, it's true that is going to keep their younger siblings from being able to go back to school, given the metric that the governor has set for in-person schooling.
Rachel Monahan with Willamette Week. Did you have a question? And
Yeah.
Are you able? Okay.
Yeah. Hi. So two questions. My look at the data, like the data you have up on the dashboard, suggests that Multnomah County hasn't ever met the 3 weeks in a row threshold to reopen schools fully, that 80 cases a week since there have been data. And I'm just wondering, is there a point at which you would recommend that the county go back to stay at home in order to open schools? And the other question is related to testing shortages. How are you seeing that? Is that in I just looked at the positivity rate. It doesn't seem to be going up yet. How are you measuring that? Is that in average time it takes to get test results back? Thank you.
Sure. So I would have to double check, but I believe the school criteria is based on last 7 days. And Kate might be able to double check that.
Yeah, it's 3 consecutive weeks.
3 consecutive.
Yeah.
Okay, so last 7 days times 3
Yeah.
consecutive weeks. So would Multnomah County consider going back to a stay-at-home order? That would be for our chair to decide. It's not clear from our disease patterns that it's retail or bars or restaurants particularly driving spread right now. We're always looking for those policy questions and answers in our data. And so far, it doesn't seem to be the businesses that have reopened that are really driving spread. Again, where we definitely see spread is in people's social gatherings, which with a stay-at-home order, I mean, we can order people home, but humans are, as social creatures, can and probably will still find ways to get together. So I think and I keep saying, I always say we're entering a period of uncertainty. Every period is uncertain. So we're really knee deep in human behavior and how to influence it, and how to influence it in a county of 800,000 people whose kids need to get back to school. So to answer your question, I don't foresee a Multnomah County stay-at-home order in the near future. I think we have other things that we are working with the state on and that we would like to try. But no question, it's going to be very, very difficult to meet the in-person metric for K through 12. To your second question around testing shortages, we hear this from health systems that we're in touch with regularly. We see it in our private lab turnaround times. And you're right that the percent positivity takes into account numerator and denominator. And you're right that we remain just either just below or just above 5% over the last few weeks of July. I think, and I'm not sure I fully answered your testing shortage question, but if I did.
Do you have a data point on that, on how long it's taking to get tests back now versus in the past in Multnomah County tests?
I can, if you'd like, follow up. I think we had the numbers from last week for Quest.
Yeah. Oh, great. Thank you.
And Quest has kind of been our bellwether for turnaround times. It's not the be all end all, because several of our health systems are doing testing in-house. The Oregon State Public Health Lab continues to have capacity of 600 per day that they can turn around in 1 to 2 days. But it is at the commercial private lab level where we're seeing long extensions in turnaround time. So yeah, Kate can get you what it is this week.
Thank you.
Dr. Vines, Pat again. Rachel's question, I thought, brought up a good point that I've been meaning to ask you, and that is, with the governor's criteria, do you think that it's too aggressive and too low? Do you want to make some news and just say that it's a ridiculous number, it needs to be raised?
I won't say that. I will say that the governor has an extremely difficult job making policy statewide from school districts that I think I heard range in size from less than 10 students to probably more than 1,000. So I think the concern from teachers in particular was part of this, and I think also just the general learning that we still have to do around how to safely reopen it and bring children together safely. I think it's again, I've said over and over, it's going to be incredibly difficult to meet that criteria. And in the meantime, I'm hoping again that the science will evolve, that we'll learn from other jurisdictions' experiences and figure out how we can get our kids back to school safely.
An excellent answer. Thank you very much.
Dr. Vines, it's Amy Green at the Oregonian.
Mm-hmm.
A follow-up to that, I just want to be clear on this. So do you support the governor's metrics for reopening schools? Do you agree that they should have been set where they have been set?
I think the level for reopening schools, I don't think there's a right answer. I think it's a balancing act. I think the governor and her team, looked at other countries, looked at the direction our cases were headed. So I can't say I disagree with it. It is very stringent for a county of our size and a county that's experiencing the level of disease transmission. But again, for schools to remain closed for the foreseeable future, I think is a safe move. And again, allows us time to figure out what's going to work and what's not.
Okay, thank you. A couple other questions. So I think it was last week, the latest week, the data was available, something like 52 or 54% of people in Multnomah County who had tested positive, their cases couldn't be traced back to a known source. How does that work? Like, if any of those people say, I did eat out at a restaurant, or I did go to a bar one time in the last week or two, would that case be counted as traceable to the bar or restaurant?
So thank you for this question, Amy. It's a good chance for me to clarify the goals of contact tracing. So contact tracing, the goal is to interrupt disease transmission. And so the public health interviewer is trying to map out, okay, where did you spend time during the period that you could have infected other people? And through that, their main goal in their 1-hour interview is to get names and contact information of people exposed so that we can reach those people so that they can quarantine. In the course of that interview, there's a million questions that we would all like answers to. And what you're referring to is source finding. So unless somebody says, oh yeah, I worked at, work site XYZ, and we know that there's an outbreak there, that person gets put in the bucket of linked to a known source because they're part of an outbreak, they're part of a known transmission chain. We don't do an exhaustive interview of every case to figure out where they may have been infected. So we have to go back through and look through notes, look through things that people have shared about where they think they might have gotten infected. But to do actual source tracing is a little bit different work, and it's sort of secondary to the contact tracing piece, if that makes sense.
So yeah, it does. So if we determined that we don't know where someone got sick. They may very well have eaten out or gone to a bar. We just don't know. We just know there wasn't an outbreak at that restaurant or bar. So we're not going to say that that was the source.
Correct. And every case gets designated as not traced to a source until our contact tracers are able to do their work and either link them to a known transmission chain or not. So there's a delay of a few days, maybe longer, depending on test results and all those other things that have to happen. But to your point, correct. We can't say, oh, it's because you ate out this one night at this bar that you got infected. We're looking for patterns. We're looking for commonalities. And so these cases that aren't traced to a source, we can't piece together from the information they share with us what transmission chain they're part of, if any, or if they're part of a transmission chain that is separate that we don't know about and may or may not be related to restaurants or bars.
So I guess
for that, Amy, maybe one more, and then we can wrap it up.
Okay.
Okay. Sorry, let me just see what the most important question is. I had a couple. I guess I'll just ask. The 4th of July, it seems like we saw a bump in tests to positive test results. July 14th, I think, was a record day, and then there was a record day several days after that, at least statewide. And then it seems to have gone back down. Do you think that was a 4th of July bump? Do you think that there will be another bump after Labor Day?
So I'll share a couple of opinions. I think we did see an increase from 4th of July, and that I'm able to say that because again we had outbreaks and we had cases traced to specific July 4th events. So these close social gatherings of families and friends. I'm hopeful that as face coverings and masking becomes more universal, there's good evidence that can actually bring cases down. And so the governor kind of strengthened her language around face coverings over the month of July. I think she most recently closed some loopholes. So I'm hoping that we will see some benefit from universal face covering in the next few weeks. So there's sort of this tension between people continuing to socialize, and especially 20-somethings, but also we may be able to see decreases in disease transmission from wider adoption of face coverings.
So is it too early to tell then if the face coverings are working, because the numbers have gone down slightly? I just assume because the 4th of July bump is over. Do we know if face coverings is working?
It's always too soon to tell. Again, we'll be able to comment on this much better in about 4 weeks. So yeah, I think again, I'm always happy to answer your questions weekly, but in terms of discerning patterns and cause and effect, it's really a broader, longer time horizon that we need to examine.
Thank you.
Yeah, that's about it. Be well, everyone.